Okay. We will call this meeting to order. We'll start with the roll call. Start with the sheriff, please.
Present.
And you are who?
Sorry. Tommy Johnson, third present.
Okay.
Mike Sullivan for Rick Warren.
Marissa Treat.
Butch Freeman.
Jessica Clayton for County Commissioner 1.
Larry Stein.
All right. Roll call is over. Oops, wait a minute. We got one more.
Ladies and gentlemen, the late Miles Davidson.
The, the late Miles Davidson. He's here.
Finally. Sorry.
All right. Notice that this meeting was posted on October 16th. Next is the Pledge of Allegiance. Miss Marissa, would you mind leading us in the pledge, please?
Let's stand up.
Pledge allegiance to the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Thank you. Okay, next item is discussion possible action to approve the minutes.
Motion to approve.
Second.
Got a motion and a second to approve as presented. All in favor?
Aye.
All right. I will say that was easy, but it wasn't. Consent agenda items number 3 through 28. Is there a motion? Does anyone have any questions or comments on any of the items? Hearing none, is there a motion?
Motion approved.
Second.
Got a motion and a second to approve consent agenda. All in favor? Aye. Item number 29, discussion possible action, the monthly financial report to be presented by the County Clerk Finance Department. I'm good. How are you? You look like an old county treasurer. Oh, you are?
All right. So on page 2 here, which is general fund budget, after the supplement was approved, the budget numbers were updated on here. And if you look at the reserve amount, the total reserve right currently for the month of September was $9,746,806. And then on the reserve here, this is what's was expended out for the month of September. This is on page 3. That what you guys approved at the last budget board meeting to move over some of the ARPA money, which makes up that $8,092,110.09 in the supplement reserve for now. So we decided to do something with that later on. And then we have the assessor transfers, the DA's IT, and then the excess reserve, we have 59,479, and then the treasury resale for 470, 467.91 for a total of 9,746,806 in the reserve.
Okay, so that's what's going to be, is that already, all right, that's what's going to be in there, or was that?
That's what's in there currently.
Okay, gotcha.
Yep.
And that's what made it up.
Yeah.
All right, good.
Okay. And then on your page 4, which is the general fund budget analysis, ending cash balance at the end of September was $14,639,747. And then on your actual comparison, which is on page 5, if you look on that second-hand box on the right-hand side, your 24-25 year to date was at $14,639,747.36, and compared that to a year ago, we were at $14,004,999. 923. So we're up 634,824. And then on the employee benefits, which is page 6, ending cash balance for the September was 1,197,791. And then if we go to on the year-to-date comparison for the medical and RX plan, I'll let John give you a better breakdown on that category. And then on the employee benefits comparison, which is page 8, same thing, right-hand side, that second box, the year-to-date. The September year-to-date was 1,197,791. And then this time last year was 643,340,000. So we're doing a little better this go round. And then the last one is your capital project, which is on page 9. We added a new line item, which was the courthouse maintenance, but that it was not funded during the month of September. That was approved at October 2nd's meeting, so that number will be in there for next month for the courthouse maintenance budget line item. And then on your unallocated funds, that was 2,458,221, but 2,050,127. That was the tip deposit, which was reimbursement, which we transferred out on October 2nd for the PBA stuff. So taking that out, the unallocated amount is $408,094 on that. Okay, and that's all I have for y'all. Any questions?
Are there any questions? Do I hear a motion to accept as presented?
So moved.
Second.
We have a motion and a second. All in favor? Aye. Thank you. Okay, next item is the 24-25 watch list. Mr. Cody.
Good morning, y'all. Have a
You all, that's Southern Missourian for Ewans.
y'all. We have a few changes to the watch list this month. We've got a recommendation on your agenda, item number 39, slight correction to the pay change increase that was approved on the September supplement. We also have a couple of recommendations that didn't make it onto this agenda, but it will make it onto the next agenda for the assessor's office, $100,000 for a capital project, as well as $50,000 for a postage increase. Those are the three changes to the watch list. Albert had mentioned the reserve balance at $9,746,000. That was, I believe, as of the end of September. Your October, you guys had a special meeting here a week or so ago where we had approved some contract increases that were $17,223.73. So the actual reserve balance right now is $9,729,582.54. I'll only bring that up to let you know if you approve the pay correction, and then at the next agenda when we have our other two recommendations on there, if you fund all of our recommendations at that point, the remaining reserve balance would be $9,579,582.54. That's all we have this month.
Any questions? Hearing none, do we have a motion?
Second.
Okay, we have a motion and a second to approve. All in favor? Aye.
Thank you.
Thank you. Cody got out of Dodge as quickly as he could. I'm always concerned about that. All right, John.
Good morning. This report compares claims, medical and prescription paid through last Wednesday's meeting versus the same period last month or last fiscal year. For medical, we paid 15 weeks of claims so far through last Wednesday. Same period last year, 14 weeks, so we paid one extra week. But our average per week is looking good. We're $339,000 per week this fiscal year paid versus $351,000 last fiscal year. You know, we paid one extra week, so we're ahead about 3%, 167,000, but overall, medical is doing really well. Skip down to prescription, the next line. It's apples to apples comparison, 17 weeks of paid claims versus 17 weeks of paid claims. And these are the numbers I like. We're down 12% or 430,000 on that. Our weekly average so far this fiscal year, our paid claims is $217,000 per week. All last fiscal year, we averaged 240,000 as our average per week. So averages are looking good. Claims are kind of trending down. Overall, if you combine medical and prescription with paying an extra week of medical claims, we're down 3% or 263,000. If we factor in reimbursements, there's really just a timing issue in reimbursements. We're set to get another prescription rebate check the first of next month, so it just hadn't come in to bounce off the last period. But so that's kind of what's skewing this report. We haven't received that rebate check, which we should before the end of this month or around the 1st of November. But overall, we're about 4% over, but just because that rebate check. But overall, prescription and medical claims are down.
Do we know approximately or exactly what that rebate check's going to be?
Well, I actually have 111,000 of it right here, and then the remaining should be close to where we were at last fiscal year. So we should be just flat at the same amount, which is good because our claims are lower.
Do we have a feel for, I mean, great news, but do we know what's driving this great news?
Well, you know, claims can go up and down based on utilization. Providers have a year to file a claim. So we're not dealing with current medical situations usually, but we're dealing with stuff that happened 6 months prior down the road. So, you know, I just see our big claims trending down a little bit, all those big cases. I get notified. Some days we'll have 3 cases in one day come up, big cases. But I see those really large claim notifications and big cases turning down somewhat. And our prescription really is all the changes we made last fiscal year just starting to come to fruition. Really getting to see that. So less big cases on the medical side, thanks to our members. You know, it's all based on them. They have a blank check they can write every day when they go to what provider, but those claims are trending down, and prescription's really just based on the changes we made last fiscal year.
Okay, that's a good explanation. Thank you very much. Any other questions? Hearing none, do we have a motion? Okay, who made the motion?
I did.
Got a motion and a second. All in favor?
Aye.
Thank you.
Thank you, John. All right, what are we on? Number 32. Larry.
Randy, I visited with a couple of the members of the trust, and they were asking what kind of information we needed. And I just appreciate an overview of what's been happening, so we'll know when we go out in the county and visit with people, so they can talk to us about what's happening at the county jail. Appreciate you being here.
Brandy. Hi. You have become very famous.
I can put them down if you want.
Let me get myself together here. I'm sorry. This is, as you saw, I showed up late. I'm trying to pull together some information as quickly as I could. What I'm going to do is just give you a high-level overview. I welcome any of your questions, and if there's specific information that you would like to know, I'm more than happy to follow up with any information that you would like to have. Again, very high-level, very rudimentary information. I know we're not going to talk about this yet. I just know that the hot button topic right now is going to be the medical situation. We have went ahead and transitioned over. We're still compiling all of the budgetary data to see exactly what that's going to cost. Some of it we're still having to estimate what it's going to be. We're waiting for additional quotes for med mal insurance. One of the quotes that we got, as you can imagine, it's very hard for people to have an interest in providing coverage for us. So trying to find the right insurance company to cover us is going to be a challenge. But we did get one quote back. It looks like it's going to be somewhere between $1.1 and $1.5 million. Kind of anticipated that. Overall, not sure what that means for our bottom line. We're still shopping around, but we've transitioned medical staff over onto our payroll, and we have a couple of open positions that became open because we opted not to employ some individuals. But overall, the continuity of care is in place. We did reach out, Chris reached out yesterday to Mr. Wilkerson about the pharmacy. And so we're going to be exploring that as an option for our pharmaceuticals. Other than that, if you have any specific questions about that, I'm more than happy to try to answer them. If not, I can get back with you with information.
Thank you. I don't have a question, but I just wanted to say that our payroll team and yours, I think, worked really well together in that transition. I think there were about 60 or so employees, and I think there was a great partnership there. So just continuing to look.
There absolutely was, and forgive me for overlooking that. My mind is racing right now because I've got a lot of things going on. But the fact that they were willing to help over the weekend and through the holiday speaks volumes. It helped out tremendously onboarding that number of people at the same time. And medical and the way that they are used to being paid is a little bit different than maybe our typical structure. And they were able to be flexible and work with us on that. So I appreciate.
I heard it went really well. I think a good variety of different people that you guys brought on during that time and expertise. So thank you.
Thank you. Okay, so weekend failures. If you saw the news, and I sent out some information to the county commissioners, we had several things that happened. I'm not going to get into the technical details because that's not my area of expertise. If you do have specific questions about that, I do have our facilities director, Ron Anderson, here, and he can speak to the specifics. Essentially what happened is that we had some failure with some of the plumbing, and it ended up flooding the whole receiving area. Then we had additional failures that resulted in flooding in our training area and in some of the areas of the basement. And then we had flooding upstairs as well. So it was just a perfect storm. Multiple things happened all at once. Our maintenance team worked really hard over the weekend to get everything repaired. Hot water was restored to the residents on 10, 12, and 13 as of yesterday. They were waiting on a vendor that could come in because of the pipe size. They didn't have the tools to fix that. Moving forward, they will have the tools that they need to fix it in-house and immediately. As a result of this, and this isn't on here, people were moving equipment out of the way to try to protect it. And in doing so, when they went to plug it back in, they did not contact IT. And so that created a situation where our entire system went down, our information technology system. Lots of troubleshooting there. We finally got back up online Monday evening, and now everything's back to, I don't want to say normal, but we're operational. So don't have estimated cost on that yet. I know that just to call up a vendor just to repair the hot water was somewhere around $4,000, which I thought was very reasonable considering that we had people on 3 different floors that were without hot water for a number of days.
Outside of that, Mrs. Lincoln, how was the play? You had a heck of a weekend.
Yeah.
But you got it all, everything is all fixed now and all back up.
It is for now. It is. We have a great maintenance team. They have us on preventative maintenance, and they're working to ensure that we're maintaining the facility to the best of our ability. Obviously, there's going to be some things that are just outside their wheelhouse, and we have to call in experts to do that. But yeah, they did a great job. They worked tirelessly to get that fixed.
Well done.
Thank you. Renovations update. I'm sure many of you are aware that we have taken it upon ourselves to begin renovating the pods. And when I say renovations, it's not any structural changes. That's obviously going to be cost prohibitive. But what we did want to do is make the space more inhabitable for the people that we have to have there. And we started out with 1 pod to test out materials and the cleaning and what we needed to do. And we picked one of the worst pods, which was for Charlie. We had to go in and deep clean. We had to use special cleaning agents to remove some of the just the dirt and grime from the walls that had been accumulating over the years. And then after that, we went and sealed the concrete to prevent bugs were harboring in the concrete, the pores of the concrete. So we went in and sealed that, and then we painted it with an appropriate paint. I know that it has been painted in the past because there were probably 4 or 5 different layers, but it was mostly latex paint, which, as you all know, is not very durable, especially at this application. So we went in and we painted it with the appropriate paint. We are using contractors to do this, and they are through Express Personnel. They've worked really well with us. And so right now we've got the 4th floor entirely completed. The 6th floor is complete, but we have some issues, as maybe you may or not be aware. The HVAC system, they're having to do some repairs on that before we can turn over the entire floor and house people in that again. And then we've done the holding cells in the intake area. And so we're just going to continue to go floor by floor and make these changes. It's something that really needs to be done. The showers, especially, that's something that the health department hits us on every single time. They were a really dark gray, matte. They had some latex paint and it was peeling, and it was hard to clean and sanitize those showers because of the porousness, the porosity of the concrete. And so they've gone in and they've scrubbed them down, stripped them, and then they've sealed them up. And so we are testing a couple of different products for the floor because it tends to pill up after a period of time. I would like to find a solution that includes like a pan that goes in the bottom of it, but because of the structure of the facility, I'm told that's probably not possible. But those are just, we're looking at the things that continually come up in the health department reports so we can be proactive in addressing those. And then I just want to point out the benefits of what we're doing. It's not just appearance, it's not just cleanliness. There's an element of improving the mental health of the people that have to be in there. If you would see some of the pods, and I wish I had some before photos up there. If you saw some of the pods before in the housing locations, it feels very dark, dingy, dungeon-like. And I can't imagine putting one of my own family members in there or somebody that I care about in there. And so it was really important to me that we go ahead and take this project on. You had asked for some information on the number of beds, Mr. Stein. So once we complete the 6 Baker and 6 Charlie pods, we'll have approximately 200 beds available. The health department and the fire department, or the fire marshal, they've rated us at a capacity of 2,800. It's important to note that that is not the number of beds that we have. They're basing it on, I think, the number of square footage, whatever calculations they use. The number of beds that we have is closer to 1,180. I don't have the information. Again, I pulled this together as quickly as I could. About 1,180. Not all of those have 2 beds in them, but even more so, the number of beds that are required, or the number of square feet that are required, we would not meet the standard per Oklahoma jail standards for most of the cells. The average size is somewhere around 49 square feet. And if you're going to house 2 people in a cell, it has to be a minimum of 60 square feet. Those are things that we just cannot change. So just kind of addressing that. As far as being able to house and contract with other people, that's one of the hurdles that we would have to overcome. And quite frankly, all we offer are closed dorms or closed cells. And some of the people that we may contract with would not like that type of setup. Open dorms tend to be more modern and viewed as more humane, especially when you have low-level offenders. And the other side of this is we don't want to get up to our capacity because classification breaks down at about 85%. And so when we're talking about exploring additional revenue streams through contracting, and then not to mention the additional strain on my staff. So this is kind of the year-over-year population. You can see each year is marked by a color, and then at the bottom it's just for the month of September. This is just kind of a snapshot. I can get you over the years the bigger numbers, but this is kind of what we're looking at. Right now, we are somewhere around 15. Our average is 1537. The number of people that we're bringing in on average is 57.90, and then the average length of stay is somewhere around 7 days. Those are just for people that are being booked in that given month. I can drill down into that data and get you some more specific information, but that's just kind of some high level information of what a month snapshot looks like. Current population today is 1,565. October 1st of last year, we were at 1,507. So our population is slightly above what it was last year. The number of people that we have sentenced to DOC that we're awaiting transport for is 138. We have 179 people that are age 50 plus, and those are considered people that are, they're a higher risk population. They have higher needs, medical needs. They usually have more chronic care conditions. The number of people that we're waiting for transport to the Oklahoma Forensic Center in Veneta is currently sitting at 24 with the average wait day of 73 days. The longest wait time right now is 225 days. And we have 3 that are awaiting their second trip to Veneta, and then we have 1 that's awaiting her 4th trip to Veneta. Then you asked about some outstanding debts. City of Oklahoma City, we estimate that they owe us $1.4 million for the previous fiscal year. That is currently under negotiation with the city, and we are actively addressing that. There's some discrepancy over their data versus our data, and we do have a plan moving forward, but it's mainly just, if we can't arrive at agreement, there may be a deadline set where I say, no more, we're not going to house city people anymore. Obviously, I don't want to go that route, but it is an option on the table. There's a couple of other options that we have available to us, but that would be kind of the ultimate problem solver. And then the Department of Mental Health, I mentioned before the number of people that we have waiting for transport to Oklahoma Forensic Center. Once they have been slated for Oklahoma Forensic Center, they're considered Department of Mental Health. They're the responsibility of the Department of Mental Health. We have been sending them billing, and so far we're up to $719,000 and some change. We've sent them a bill, and they have declined to pay it. And that is not including any of the medical visits that they have gone to if they have to be sent off-site, and none of the prescriptions. We're still trying to compile that data. Unfortunately, a lot of that is not always digitally kept, and it's not organized and set up in a way that we can just quickly pull that data. So they're having to manually go in and verify information. But I fully anticipate that number to rise to 7 figures when we're all said and done.
What's their basis for declining it?
They don't believe it is their responsibility. And so the way that we are handling that, and without saying too much, is our council is handling that. So there's a cost associated with housing people like this. They are typically the most seriously mentally ill, and they require a lot of hands-on treatment. Medical, obviously, there's more oversight in what we're doing with them. But from the detention side of things, they're more difficult to manage. They have a lot of needs, and it's very difficult to care for them. It's almost like you have to have an officer with them 24/7 in order to meet the needs that they have. And there's an additional cost to that too. So it doesn't even include the cost to staff. So that is all I have for you today. I'm more than happy to answer any questions.
You talk about a daily population of 1565. How many individual users of the jail do we have every year?
Let me get back to you on that number. I don't want to misquote, but it's tens of thousands.
The other thing is there anything we can do about those wait times? 225 days before they get picked up to the state pen?
So that's part of our legal approach with the Department of Mental Health, is addressing that.
Okay. Thank you.
You're welcome.
Very much for that.
You're welcome.
Appreciate it.
Any other questions for Brandy? That was an excellent briefing. Thank you very much for bringing us up to date on that. Obviously, anything that we can do as a board, or even for that matter as individual officers, please do let us know. We're all in this boat together, and your dollars start with us.
Amen.
So And again, really appreciate the efforts of you and your staff. Any other comments or
Thank you.
questions?
Are we gonna be able to put this on the webpage with our meeting? Is this attached to our agenda?
Yes, yeah, every item that's presented is
Great.
attached. But I agree, I think this was great, and I know you have a lot of things going on and got this together quickly. But I think this is, at least what I'm looking for, is just these updates, what's going on, what are the issues, because there is a price tag with all of this. And I think the more information that we have as a budget board, the easier it is to have those conversations, even though they're hard conversations, right? Because then we have more information to help figure out how to partner together to get you all what you need, and really the citizens of Oklahoma County. So I appreciate it a lot.
And Brandy was kind enough to give me a tour with some folks, and it's, when you see the improvements they're making, we don't have a choice about leaving it unfixed. We have to fix these things because it's our jail.
Right.
It has to be operated, and we have to be able to make those improvements, despite the fact that eventually we'll get a new jail.
I'd like to correct that as the commissioner's jail.
There you go. Our counties.
The taxpayer's responsibility.
Yeah.
That's
The
right.
taxpayers get the our responsibility to make sure that we use taxpayer dollars wisely to pay for the jail.
That's right.
Yes.
Thank you guys for
Thank you,
having me.
Brandy.
you.
I don't know that we have to take any particular action on this.
I'd make a motion to receive and
All right,
thank,
there you
and
go.
thank her very much.
We got a motion to receive as presented. Thank you, Brandy. Do I have a second?
Second.
Second.
Okay, got all kinds of seconds. All favor?
Aye.
All right, moving on to the departmental items. Item number 32 is the proposed dates for this coming calendar year for budget boards. Miss Marissa,
Oh, this is the day one. Wait, which number are you on?
I'm on 33.
33, okay. Yes, there should be a handout in front of you that has the dates, and sorry, Albert, and there's just a standard process for us. This handout is a little bit different than what was in the attachment, just because I had some edits to the structure of it. But that's it.
Okay,
Motion to approve.
Second.
got a motion and a second to approve. All favor?
Aye.
Aye.
Sorry.
All right, moving on to item 34. This is a rather large one.
Yep. Okay, so as you see, number 34 there, our budget fund appropriations of 147,940,023. That is after the September supplement. That's been added into what was originally approved back in July. With the mill levy of 10.35. And then I'll go ahead and address, or do I need to do 34 and 35 together, or do they need to be done separately?
I would be fine if we did them
Yeah,
together.
that's fine with me. Go
Okay.
ahead and do them both.
Okay, so then on number 35, we have the sinking fund levy on there with total appropriation of 8,647,587. And then the mill levy, that went up compared to last year, because last year's was 0.71. And the reason it went up is because there was a $3 million judgment last year. $1 million of it was purchased by the budget board, and then $2 million was kind of on the tax rolls. But the $2 million was left off the estimate of needs last year. So then adding that on to this year's estimate of needs, along with 3 other judgments that the retirement board has purchased, brought it up to the 0.83 mill levy.
Yeah, I also would like to remind the budget board, the fact that we purchase them does not change anything. What I mean by that is the levy is the levy. And so the fact that the budget board purchase them does help our budget boards. Actually, I think retirement board, isn't it? That's purchasing them.
Yeah, earn interest off. Yeah.
Anyway, so that doesn't change though, as far as the way the operation works. It doesn't change anything, and it doesn't change the mill levy and all. Okay, go ahead.
That's all I have as far as those 2 items go, unless y'all have any questions.
Unless there are other questions, motion to approve item 34.
34 and 35 together. I'm sorry, I didn't hear you.
I don't like to do that. I like to do individuals.
All right. Got a motion to approve item 34? I have a second?
Second.
I'll second. Okay, all in favor?
Aye.
Aye.
And I'd make a motion on 36, or 35. 35, sorry.
Okay, we got a motion to approve item 35 as presented. Do we have a second?
Second.
Okay, we got a second. All in favor?
Aye.
Aye.
Thank you.
Thank you very much. Okay, item number 36. Jessica.
So number 36 is moving the funds not to exceed 1 million, or sorry, $104,000. And this is for the court clerk social distancing project. It was discussed this last budget board, but they're just wanting to make sure that the funds are in the appropriate accounts. That's my
Any
understanding.
comments from the court clerk?
Move to approve.
Second.
Great comment.
Great comment. All right, we have a motion and a second to approve. All in favor?
Aye.
Item 37. Benefits and Retirement Department.
Good morning again. This is a simple network agreement. On our pharmacy plan, we used Affirmed RX Public Benefit Corporation. And the pharmacies that run claims through there use this network. So this is their network that they run pharmacy claims. There's no cost to this agreement. This just allows us to run our prescription claims and get reimbursed for them through our own pharmacy.
Motion to approve.
Second.
We got a motion and a second to approve. All in favor? Aye.
Thank you.
Thank you. Turning the page to item number 38. John, get back up here.
Getting your steps in.
So this item is just a standard transfer item. There's no automatic mechanism to make employer premiums from the jail go into employee benefits. So this process has to be followed to make those premiums go into the employee benefits account. So this is what this item is about, just to transfer the July, August, and September premiums into employee benefits account so we can pay expenses.
Motion to approve.
Thank you.
Second.
Got a motion and a second to approve. All in favor? Aye. Okay, item number 39 is a resolution.
Yeah, this one here is that merit pay calculation for the 5,373. Now, the way I have it worded on here, not to exceed the 5,382. If you take that and then subtract the highway district, the $9, it comes to the 5,373. But if you guys want it to be more clear as to that exact number, we can strike this item and put it on for next.
I'm very clear.
Okay.
Are you clear of my large sacrifice for District 3 Highway of giving the $9?
Thank you so much. I make a motion.
Once
moved.
again, that's District 3 bailing you guys out.
Motion to approve.
Second.
Got a motion and a second to approve. All in favor? Aye. Thank you very much.
District 3.
Citizens' participation. No one signed up to participate. Board comments, starting with the sheriff.
No comment.
No, thank you. And for me.
We'll just keep that trend up.
I have the first dollar to reimburse District 3. Yes. Over there. Nothing else. Thank you.
You're gonna have heck getting the other 8. And I have no comment.
I will not participate.
Any new business to come before the board? Hearing none, do we have a motion to adjourn?
Move to adjourn.
Second.
We are adjourned. Thank you all.